The most common crimes that we deal with young people, other than traffic violations, involve substance abuse, whether it be alcohol or illegal drugs. I view drugs as a supply and demand issue. The people who are supplying the drugs, the drug dealers, need to be aggressively prosecuted and in most cases need to serve time in jail or prison. On the demand side, we have the users who in many cases become addicts. It is against the law to possess illegal drugs and there have to be consequences. On the other hand, in those cases where there is some degree of addiction, the user also needs help. We try to use the prosecution process to force those people to get the help they need. There are a number of programs that we use depending on the degree or severity of the addiction. In 2004, I developed a program specifically targeting young offenders 17 to 21 years of age. We called it Mojo and required any person in that age group who was charged with a misdemeanor crime involving alcohol or illegal drugs to spend 24 hours in the Stone County Jail, be placed on probation, obtain a substance abuse evaluation, be tested for drugs, attend school regularly without discipline problems, and/or maintain employment. This program, particularly the drug testing part, was the only one like it in the state of Missouri to my knowledge and has been very successful in helping young people stay clean and off of drugs. For more serious offenses, felonies in other words, and more serious addictions, I worked with Judge Alan Blankenship to develop the Stone County Drug Court program. This is an intensive 18 to 24-month program in which there initially is very regular drug testing, individual counseling, and group therapy. The person is required to appear in drug court in front of Judge Blankenship every other week. There are immediate consequences, usually jail time, for any violations of the program, such as testing positive for drugs, failure to go to a meeting or counseling session, or missing a drug test. As the person goes through the various phases of the program, the responsibility for the person's sobriety gradually shifts from the drug court team to the individual. The idea is to create lifestyle changes and changes in thinking and behavior that will allow the graduate to live a drug-free and productive life. To date, there have been numerous graduates, and maybe just as important, several drug-free babies born to women in the program. We have recently added an alcohol component to this successful program and now have a DWI court. The program is in its infancy, and we will report the successes of that program as they materialize. Drugs play a big role in many crimes. A large percentage of burglaries and thefts are to obtain money to buy drugs. In the past few years, the drug of choice among many users has become prescription medications. Burglaries used to be primarily to steal televisions, guns, jewelry, stereos, and other electronic equipment. We now have many break-ins where nothing is missing except the pills from the medicine cabinet, mainly narcotics. Beginning about 2 years ago, I approached Sheriff Richard Hill concerning this problem. He has placed a high priority on those types of investigations. I am also on the board of the Comet Drug Task Force that serves Stone County and several other counties in this part of the state, and that agency has worked closely with our officers to investigate drug sales in Stone County. By utilizing an officer devoted full-time to drug investigations, confidential informants, and the resources provided by Comet, we have been highly successful in the past 12 to 18 months in making cases and arrests of persons selling prescription drugs. In January, approximately 25 drug dealers were arrested as part of that undercover operation. All but 3 of those cases involved the sale of illegal prescription drugs, primarily OxyContin. We are currently prosecuting those cases, and some have already resulted in prison sentences.